Hi, I'm Dr. Shah from Hill Country Plastic Surgery. So today we're going to talk about labiaplasty. So this is a procedure that people don't really talk about a lot. When I've been in groups with other women, then sometimes it comes up because I'm a plastic surgeon, but it's usually because somebody got it done and they start talking about the benefits of it. When the labia minora, so there's two areas. Outside, it's the labia majora, and on the inside, it's the labia minora, and that's usually the area that sticks out and gets irritated. It can get cut, it can rub, especially during exercise, running, and it can be painful, can get caught, and by shortening the labia minora so everything stays within the limits of the labia majora, then a lot of people have benefits from that. So, is it a cosmetic procedure? Sometimes it can be, but for most of the patients that I see, it's actually a functional surgery. It does help with mobility and exercise and just like general functioning throughout the day. It is not covered by insurance. We've tried it in the past, it didn't work out. So this is a cosmetic procedure or a self-pay procedure, and it's something that I can do in the office under local anesthesia. It can also be done under general anesthesia in the hospital, and usually we'll do that if I have to do both the labia majora and minora surgery, or if the person just does not want to be awake while we're doing the surgery. So the procedure, there's multiple ways of doing the surgery, and it depends on your anatomy and what we need to do. So the process, it will take about 2 hours from start to finish in the office, and that includes numbing, and the actual procedure doesn't take as long, but just the whole process from start to finish takes about that long. You get to go home that day, and the recovery, it's a lot of icing. I give you pain medications, antibiotics, and usually by the week after, most people are off of their pain medications. The worst night is the first night, and as long as you stay on top of the icing, it gets a lot better after that. And the recovery is faster than with other plastic surgery procedures because the mucosa in that area heals so quickly. So usually by 3 months, then people are completely healed. So the other question I get is, what about activity restrictions afterwards? So nothing that increases your heart rate or blood pressure for about 2 weeks after surgery. You may not want to be sitting for a long period of time right after the surgery. So I have recommendations for things that you can get, such as a donut pillow and the different types of ice and a little portable bidet to help with the area. So after those 2 weeks, then you can start doing low impact exercises, and then I clear you from activity restrictions at 4 weeks. The only exception is having sexual intercourse, and I clear you at 6 weeks for that. And at that point, you're completely healed, and there may be a little bit of healing and swelling that needs to be done, but for the majority of people, everything's all taken care of by that point, and at 3 months, you're good to go. This procedure, I enjoy doing it because I think it really does make a difference, and it helps with a lot of functionality throughout people's lives. So if you're interested, then please give us a call, and we'll see if you're a good candidate.